Today's date is May 5th, 2022. This is Raymart. Raymart, I'd like to be able to put this on YouTube if we do well. Is that okay with you?
Yes.
Thank you. And you can sit up for the moment. You came to me with the following history. At one time, you were quite heavy,
Yes.
400 pounds. And you've done really well by yourself, giving you high compliments. But
Thank you.
while you were heavy, you developed gallbladder disease. And they did robotic gallbladder removal. And after the procedure, you developed pancreatitis. And then you got insulin-dependent diabetes after that.
Yes.
So you're on insulin right now. And then you got COVID after that, correct?
Yeah.
And following COVID, which was more than a year and a half ago,
About, yeah.
you developed a pain. You were moderately sick with COVID, not hospitalized, but you were moderately sick with it. You got better. And then after that, you developed a nerve pain, that you call it, a neuropathy that starts in your groin about here and then goes down the back of your leg symmetrically on both sides, but it also affects your foot, right? And when I pressed your foot here, you didn't like that, right? And when I ran my finger down the back of your leg, you grimaced, and you didn't like that either, correct?
No.
Okay. So that's a sensitivity. And you also told me that you have tinnitus that developed suddenly in one ear.
Yeah.
The right ear, high-pitched, and it's there 24/7. And your neuropathy is there 24/7. Is that correct?
Yeah.
Okay. And the tinnitus developed when?
On last year?
Okay. So the viewer should know that you've got some root canals.
Yeah.
And you got some teeth that really are in disrepair. In addition to that, you also fractured your leg, and you have a scar along your ankle right there. So we're going to use that information to see if we can figure out what to do, okay?
Okay.
So we just injected 2 teeth. Any change?
Less pain.
Less pain?
Yeah.
Less pain where?
On the back molars.
In the back molars? You were having pain there?
Yeah.
Okay. How about your legs?
A bit better.
A bit better?
Yeah.
All right. Lay down, please. We just injected the second tooth on the left upper. Would you get up, please, and do your thing? I want to know what's going on with your legs.
I think it's much better.
Much better, you said.
Yeah.
Okay. We got one more tooth to go. You can lay down. Get up. We just did the third one on the upper side, left upper. Walk to the door and back and tell me how your legs are feeling.
Great.
Great. Is there any pain left? And you told me that this pain was so bad that you had to stop work as an occupational therapist, and you've been on disability since. Is that correct?
Yeah, that's right.
And your doctors told you it was post-COVID syndrome.
Yeah.
And then there was concern that it might be diabetes. Is that correct?
Yeah, it's both.
Both.
Yeah.
Okay. Let me see you sit down in that chair and then get up and walk to the door. Okay. What are your thoughts?
compared to before, it's much sharper.
What's much sharper?
I guess my walking.
Oh,
And like,
you're saying the walking is better.
yeah.
Yeah, let me see you do that again. Walk again. Yeah, I noticed that. I think your gait is better. And we didn't even address the fracture in your ankle yet,
Right.
which we still have to do, and your gait is already better. And you're an occupational therapist, so you know what the word gait means, and you know what to expect, you know what you're looking for. So that's better, and the pain is gone.
Yeah.
Are you surprised?
Yeah. Yeah, very much so.
Very much so. Mom, can I get you in here, Mom? May I?
Sure.
Mom, you're a nurse.
Mm-hmm.
I have your permission to video you,
Sure.
and you'll be up on YouTube too. Are you surprised by this?
Yeah. Well, that's a surprise.
Almost like shocking.
Mm-hmm.
You didn't
That's
expect. You didn't expect this.
No. Before this, it was like having really pain. It was like holding on
Holding on to his leg.
to his leg.
Okay,
Yeah.
I'm going to show you both what led me to do this. Okay,
Okay.
come on over here. So, the first tooth I did was number 2, second molar. Please look here at what organs and meridians it deals with.
Stomach, pancreas.
You have diabetes.
Yeah.
All right, now let's go over to these two. 13, 14, and 15, especially 14 and 15. What's this say?
Stomach, spleen, liver, kidneys.
All right.
Kidneys.
Spleen pancreas is one meridian. It's the spleen pancreas meridian. And have a seat. In fact, you can lay down. The stomach meridian runs down this part of the leg. And if you recall, I pressed right here and asked you before, was it painful?
Yeah.
You remember that?
Mhm.
And you didn't like it. You winced. You said that's painful, correct?
Yeah.
The spleen meridian comes down here, right where your pain is, and it goes right along here. There's acupuncture points here for the spleen meridian, which runs along the toe. So these are two meridians that control the leg, and they control the autonomic nervous system of the leg. The sympathetic nerves of the leg are controlled this way.
Okay.
You have several diseased teeth, at least 3, maybe 4, and they tested positive on my testing. And then I temporarily, do you understand temporarily, took them out of the circuit by putting a local anesthetic in. So they're removed from the circuit, freeing up the nervous system. And bang, your pain was gone instantly.
Okay. Wow.
Interesting?
Yeah.
Mom, do you ever see anything like that?
Yeah. I'm glad.
Okay. I'm not going to do anything more about the pain except send you to a biological dentist. Okay? You guys came up from Los Angeles, is that correct?
Yeah.
Okay. We need to find you a dentist in Los Angeles who can do this work. But I believe you have infection in those teeth. And the infection in those teeth is deranging your nervous system, especially the meridians involved. And it's also possible it played a role in your diabetes.
Makes sense. Okay.
All right.
Let's get to it.
I'm saying it played a role. I'm not saying it's the cause. You have reason. You can sit up. You have reason to have had pancreas problems. You had gallbladder surgery and then you got pancreatitis afterwards.
Yeah.
And the gallbladder surgery probably did that, and that's what caused your diabetes. But it's also possible that you were set up for this by having weakness in the meridians. Am I making sense?
Yeah.
Okay. I have your permission to post this?
Yes, sir.
Thank you very much. Yeah, I want to make it clear. I cannot fix your teeth. I can only find a problem. A biological dentist is the one who will have to work on your teeth. Because you had 100% reduction in the pain in your legs, I would say there's a better than 90% chance your problem's coming from those teeth.
Okay. Let's fix it.
All right. How's the ringing in your ear?
Still there.
Any change?
Not much.
Okay. The ringing in your ear probably is something else. I'm going to instruct you on putting ozone into your ear to see if we can help that. Okay? It's called ear insufflation. Okay. Okay, Raymond. We just injected this scar here, and the viewer can see that. And I asked you to get up and walk and see, and asked you if you notice anything different. You were about to answer?
Yeah. The pain, it's not there anymore. And I feel the balance is much better too.
Your balance is better, and the pain in that ankle is gone.
Mm.
Let me see you walk to me. Wow, and back. When you first came in here, remember I said you've got an issue with your gait. Remember that?
You're right, yeah.
And I think your gait is pretty good right now, wouldn't you say?
I think so too.
You ready to go back to work as an OT?
Yeah.
I caught you, huh?
Yeah, get me.
All right.
I'm about to apply.
Excuse me?
Yeah, I'm ready to apply.
Very good. All right. The injection in the ankle scar is just a one-time thing. Occasionally, we need to do it again. Your teeth, however, require a biological dentist, so we'll try and get you one. I want to thank you for coming in and giving me an opportunity to work with you.
I appreciate everything.
Thank you. Raymart, I want to close with the viewer knowing that because of the pain, you were placed on an SSRI drug, Cymbalta, correct?
Yeah.
And it didn't do anything for you except addict you to a drug.
Unfortunately, yeah.
Yeah. That's the practice of medicine in this country. Band-aid it, suppress symptoms. Don't go for the cause and fix the cause.
Yeah. Get me paying out of pocket a lot.
We should be able to get you off of the Cymbalta fairly quickly.
Hope so.
I forgot. You're on gabapentin as well, correct?
Yeah.
Neurontin. The doctors don't know anything. They just load you up with drugs. Sorry that happened.